future purposes. When wishing to speak, would you please use the raise your hand function on screen, or if that's not available for you this evening, please drop a line in the chat or use your own hand on screen. When the chair calls you to speak, if you wish to speak, could you please ensure that your camera is turned on and, in line with the Local Government and Elections Wales Act 21, in order for those that are viewing can actually see who's on screen. Thank you all. Over to the chair.
Okay, thank you very much. Do we have any apologies for absence, please?
Yes, Chair, we do. We have apologies from Councillor Lloyd Selby and Councillor Buckley.
Thank you very much. Okay, so item 2 then, please. As we haven't got anybody from the voluntary sector, I think we're going to have to push that over to the next meeting, aren't we, I'm afraid? Okay, item 3, minutes of the meeting from the 23rd of January. You should all have a copy in front of you. Okay, I will only make the point that there was nobody there from the voluntary sector last time either. So that's a disappointment. And I think it means we're going to have a really good think about how these meetings are conducted going forward. But apart from that, me raising that point, is there anything anyone else would like to raise on the minutes, please? No? Okay, can we accept those as a true record then?
I let us stand, yeah.
Right,
I'm happy to accept those as a true record.
Thank you. Okay, so declarations of interest, please. No? Okay. So let's look at the report from the voluntary services, please, which is towards the back of your pack.
Chair, as I mentioned to you earlier, it's entirely up to the committee. Hang on, somebody's trying to come in, I think.
That's Linda. Yeah.
Linda, yeah.
Who's doing the presentation?
Yeah. Linda?
No, hang on. Camera on, isn't it? There we are. Sorry.
Hiya, Linda. Thank you for joining.
Hello.
We've got your item as the second item on the agenda. We were waiting to see if Rachel was going to join to deal with her report from the voluntary sector, and I was just in the middle of saying to the chair, it's entirely up to the committee whether they want to take this report as read or make any comments, or wait until the next meeting for Rachel to present, although I know this report is last year's report, so it's a matter for the committee to decide how they want to proceed.
Thank you. Thank you, Linda. We'll come to you in a minute. Okay, does anyone have a view on whether we would like to accept this as is, or whether we'd like to defer it? Jane?
I accept.
Well, I would like to accept too. Oh, sorry, I forgot to put the camera on. Simply because I wouldn't have been there last year, so I wouldn't know that the record, that would be the case.
Okay, thank you. So we're going to Millie, do you want to come in?
Yeah, I'm happy to accept that as well. Been on the committee for a few years now.
Okay, you have to come on camera.
Sorry, I did press the button. I thought it'd come on.
No,
I do apologise. Yeah.
Right. Okay. Thank you very much.
Yeah, I'm happy to accept.
So we're going to accept the report as is, and we're going to move on to Linda, who is going to give us.
Chair.
Sorry.
Chair, sorry to interrupt. I just wanted to mention that obviously when we're accepting the report, you're also happy for it to be forwarded to corporate performance and resources as in line with the recommendation, so they can actually consider it as well. And I will let Rachel know that we've passed it on, for her to go to that meeting if necessary. Okay.
Okay, thank you. Yes, we're happy for that, aren't we? Unless anyone else wants to object now. No, that will be the process. Thank you very much. Okay, I'd like to welcome Linda then, please, who's going to talk about mental health and emotional well-being. And so I'm going to come off camera now and hand over to you.
Thank you. Thank you. I don't know if Pam is here. I emailed Pam a copy. I was doing a PowerPoint. Don't know if Pam, whether there's whether you've got access to the PowerPoint, and whether I can. We don't usually use Teams. We usually use Zoom. So I need to sort of see if I can get it up. So.
Want to send it to me, Linda? Send it to Karen Bowen, and I can put it up for you.
Okay. What's your?
It's kbowen@valeofglamorgan.gov.uk. I've just sent you an email tonight.
Audio?
So if you have a quick look at
Thank
your emails, you can just respond with that if you can attach the presentation.
Sorry about this. I'm slowing you all down.
It's okay.
Have you sent? You just said you've just sent it. Did you?
I sent it to you about half an hour ago.
Oh right. Oh, okay. Brilliant. Thank you.
So if you want to respond back in that email and
Okay.
attach your presentation, can you find it?
Yes.
Yeah.
It's gone. It's gone off to you now, so hopefully will come.
Give it. I don't know what size it is, but give it a couple of minutes, and maybe it'll come
Yes.
through.
It's not huge. Sorry. That sounds mega fantastic PowerPoint. So I could just talk anyway if you like to start off the ball roll, to prevent people having to wait.
Yeah, you can certainly start talking, and if it comes through, obviously I'll put it on screen straight away.
Yeah.
Thank you.
Okay.
Cheers.
So I don't know if people know me. I'm Linda Newton from Cardiff Vale Action for Mental Health, and I'm part of the GVS and the networks that GVX organise. And our function is to support voluntary sector groups with an interest in mental health across Cardiff Vale. So we coordinate our own networks in relation to mental health and wellbeing, and we develop training and development services and co-production initiatives, lots of different things like around those sorts of topics. So our main forum is the Cardiff Vale Mental Health Forum, voluntary sector groups, and we've got, thank you, we've got interest groups around different elements. So we've got a Vale members group, and we've got a BAME interest group and a counselling services group, substance use, various different groups according to people's interest. And there's 100 voluntary sector groups who are members of that forum at the moment. As you can see, there's 30 of those operate within the Vale, of which, you know, some that are part of carers groups, and I mentioned AIM counselling services, also an older people's group. So lots of different bits and bobs around that, because of course mental health affects all of us, doesn't it? So every voluntary sector group really has got an interest in it in some way, and it affects everybody and their members and the people they support. So that's a bit about us. And so are you able to move on to the next slide, or can I do it? Do it, right. Okay, and so I suppose we operate within the context of the Social Services and Wellbeing Act and the Together for Mental Health Action Plan, which is joint from the Welsh Government. It comes down, led by the NHS, but is a joint plan. And the role for the third sector there is about increasing the level of early intervention, prevention services, wellbeing, better access to information, advice and community resources, voice and collaboration, what matters to you, what matters to you matters to us. And there's all those things obviously pertain to the third sector, that's core to what we do anyway. And we feel we've got a role in all those elements below: reducing health inequalities, strengthening co-production, supporting carers, strengthening protective factors, prevention and wellbeing, supporting people in crisis, support to access community services. And for us, key is partnerships and resources between our third sector ourselves, statutory services, and within the community. So that's sort of the context within which we work. And of course, that means that services need to be co-produced, person-centred, need to be connected, holistic, and community-focused. And key to that, and for us to make things work, is that wider partnership working, which is so core, but takes a lot of time, doesn't it, to do. So it's something that often is the cause of making things work, but falls off the end sometimes when things are pressured. And just to fit in, we do that within the context of the Cardiff Vale Charter for Mental Health, which the local authorities are signed up to too. So thank you. That's that for the background. So those really, and we've been looking at this as a forum as a whole, what the future challenges are and the issues, and trying to link in with the Mental Health Clinical Board and the Health Board at the moment in their 5 and 10 year review and their intermediate plans. And really, the challenges and the priorities remain the same when we've asked all forum members, and as has been in the past. So providing holistic help and a range of services, making sure co-production is key to everything, prevention to avoid crisis, and I suppose the most current things, isn't it, that affects us all, the cost of living and digital access, and the impact of cost of living is the new thing in terms of digital access, which is actually lots of members saying is going backwards. It means that people can't access services even at that basic run because so much now is online. So that's that one. So you can move to the next. Right. So this is a bit of a sort of all-embracive list, really. So apologies for that. But when we asked members, I just thought I'd share with you what people saying now are their pressing issues in terms of the membership. So for all, cost of living affects agencies too, and money for resources is key as costs are increasing. And I know Vale have been really good at supporting the voluntary sector. So thank you for that. And I know that is affecting everyone, every agency, everywhere. And also, of course, on the individuals that we're all supporting and the impacts then on their mental health. And the stresses also, second to this really, is difficulty in accessing benefits that people are entitled to in the long drawn out time it takes before decisions are made. So all these additional pressures coming on that affects people's mental health and well-being. And in terms of agencies, I feel that's led to, well, it has led to lengthening waiting lists and backlogs for services. So it's not just statutory, voluntary sector services are getting long waiting lists, 6 months a year now, so where they were never there before in the past. So the access for minority ethnic groups are getting hard and problems getting heard. Carers waiting longer for respite, overstress and overwhelm, that's what people are saying. I'm not sure that there is fewer carers, social workers, but there's a feeling that access to support is getting harder. Long gaps between assessment and support, and people were expressing that people are feeling let down at the point of contact. They might have waited ages for assessment, and then of course maybe they don't access anything, or then being signposted somewhere else takes a bit of time. So I suppose the difficult accessing community connectors. So I suppose that adds to everybody's stress, doesn't it? And that feeling, does anybody care? Is anybody out there? And I suppose that's what you would expect in the time of cost of living rises and pressures on services left, right and centre. And of course that leads to things like breakdowns in communications. Still feeling that there's difficulties between getting support for people with substance misuse and mental health together. Although there are new services being developed around that, it's just a sort of constant, isn't it, trying to make services that enable people to feel they can link. And of course, there's the residual impacts of the pandemic on demand and supply, and the effect of the move to telephone rather than in-person appointments. That's still there. I mean, things are going back face-to-face a bit, but there's still a lot now that's telephone access or online. So that's a bit of a whir, but there are things people are sort of tackling it. So it's not necessarily completely negative. So I've gone through a lot of it. Some of these referrals are co-occurring, the difficulty in that. Lots of referrals coming from the statutory sector now to the third sector, and as I said, lots of those are co-occurring with substance use. And sometimes agencies feel that people are not quite hit the right agency, but that shows the difficulty, isn't it, in knowing what's out there, connecting with what's out there, and the fact that there might not be an appropriate service out there. So, and the real importance of everybody knowing what else is going on. I mentioned about services going back to face now. Some are still online. And I was just feeling, I think any social prescribing needs to occur in partnership. So that there's a lot of push for example, from the NHS to socially prescribe to third sector services, but that needs to be done in partnership with services, so that they're properly peer and community led, and that they can meet unmet needs can be met at the local level. And what it means really is developing more services at local level. It's going back to those old community development ideas of needing to develop things locally and build things and more things, and people connected with those through the involvement of people themselves. So and that would help to increase support. Next one. I hope this is all making sense and rushing through it. And it's just a bit of an example that from the Cube, they've seen 70% increase in referrals from CAMs and GPs, and the majority of those are self-harming and suicidal thoughts, and that the age range has gone down. Now, some as young as 5 to 6, have been 11 to 15 before. So then there's a bit about Cube services there. So that's just a bit of a highlight really from one of many of the agencies that have flagged up the increase in demand. And the next slide. I'm repeating myself here, just to get feeling that there's a gap for support for carers, gaps in perhaps counselling services and the range of those connections and how those services and how they fit together. For example, long-term health needs, there's a bit of a gap there, and gaps between high and low level support. Next slide. Something like transport costs, obviously everything's going up, isn't it? And people with disabilities increasingly able to afford costs, able to access services and appointments. So it's like people haven't got money to access digital, they haven't got phones or data on their phones, so they can't access services digitally, but the physical cost of getting somewhere is also an issue. And it sort of goes back to trying to connect where people are at and how best to do that. So of course all these economic impacts and the social determinants of health have an effect on mental health. Just really emphasising really social interaction is crucial for wellbeing. You know that, don't we? And identity, sense of low self, loneliness, all those are important for interaction, to alleviate mental health needs and to make an impact of social determinants need to be focal consideration of service provision. So that's what the third sector, mental health third sector, still feel. It hasn't really changed, and we're looking forward to the Social Care in Wales review to sort of emphasise and stress what the importance of social care is. So I know I think probably everybody agrees with that. And I suppose what everybody feels is the importance of information and with that digital impact, not to think the need for physical hard information still, that and non-digital forms of communication, that people don't access websites, they don't see that information, whether they might be from deprived communities or mental health. Hearing voices is really hard to look at things online, might be culture and language, might not be preferred mode of access. It's not just older people that it affects. So just to really emphasise the importance of physical information still to enable people to access things. And alternative options in terms of online service delivery. There's so many things now, you have to have Wi-Fi to access, and that's especially in the NHS, and that's really hard for some people. And then the other thing, a plea from agencies, there's been a lot, for example, in the house, there's been a lot more teams and developments, especially in CAMS and emotional wellbeing services for young people, say, and some adult services too. But unless those are properly mapped and joined together, it's quite hard for us and for everybody in the agencies, let alone people who lived experience trying to access services, to see what those services are. So whenever any layer is added on, it's just a real clear need for services to be mapped clearly. And then to support that is joint training, because that's a usually useful way to connect and inform. I know we've been running a mental health training programme and we've opened that up to local authority staff, and it just really helps that everybody's training together, builds understanding and makes those connections and signposting that much easier. Next one. So prevention, formal routes, that's still important. Co-production, that's so important, and developing peer groups and lived experience groups. So I know, for example, we've got some funding for a small grants fund to develop to support the development of peer and self-help groups, and yeah, so that's it's temporary funding, but we're sort of trying to make sure that can help development. And I know community centres and community services are trying to do the same. And I think generally everybody feels that it'd be really handy to build up lived experience monitoring of services and evaluation, because that to get that feedback in. Okay, next slide. This is a bit fun. I think, yeah, and the importance of partnerships with the third sector. And I know that's what this group is about, and we hugely appreciate working with the local authority on all these things and on collaborative activities. Yeah, and different agencies are doing different things to try and make that work, and we're coming together as a forum with an action plan to try and build on this together. Yeah, just mentioning there, we've been working with the local authority on the social work team around COVID action and developing that. Yeah, working together on equalities implementation. Yeah, and generally we're just coming together and see how we can tackle these challenges together, and we welcome Vale Glamorgan Council participation in that. So if anybody wants to come along to the forum or for a specific meeting around these issues, you'd be very welcome. So that's the end of it, really. So I haven't got so much on individual agencies at the moment. I could do that perhaps for a future meeting, an update on that. I've got muddled in my dates, so it was 23rd of April, not day 4th. So, but that we could perhaps get that feedback at a future date. I don't know if that's been any help, but just an update on the third sector, really interesting mental health.
Okay, thank you very much. I have to say, I think most of us has been very helpful and almost overwhelmed with information. There was an awful lot there, wasn't there? Right, okay, I've got a couple of questions, but let's see if there's anybody else who wants to ask anything. I'm going to ask people who are actually members of the committee first, and then perhaps some of our viewers would like to ask. Anyone got a question? No. Okay. Can I ask you whether you're now meeting people face to face, and I was wondering whether that's having any impact on the services, because it's quite different, isn't it? As we all know, speaking to somebody, you know, across the table with a cup of tea and a chat, than it is speaking to a screen. I just wondered if you could comment on that for us.
Yes, I think it's for a lot of people that face to face is. I mean, a lot of people do like online, but face to face is so crucial to keep there as a way of connecting and for people to be able to talk together, and even if it's doing things maybe across a cup of tea or with an activity as well as, you know, face to face in a sort of interview type situation. But yeah, definitely face to face is what it's what a lot of people like, and also third sector groups like too. So we've still got, in terms of agencies, we still meet a lot online, but we have networking events face to face, which are hugely well attended. So for agencies too, that way of connecting, those talking around the edge of things, isn't it? It's so important. You can't do when it's online. Okay. I miss this being face to face too, to be honest.
Well, yes, it is. It's a pleasure to be in a room with somebody, isn't it? You pick up the vibe of what's actually happening, don't you? And yes, you can spot body language much better when you're in the same room as somebody, which is a real giveaway for people, isn't it? I was going to ask you, you're talking about the outreach. Now, I was in a meeting the other day, and I think a couple of people on the call were also in that same meeting, where somebody from the Citizens Advice Bureau talked to us and said that what she was doing and her team was they were going out into pubs in order to you know, reach people who would never come into an advice session. And so they were approaching them. Yeah, they were just being in the pub, and people could come up and have an informal chat in a way that they wouldn't do if they had to make an appointment and go to a building and so forth. And I wondered if you could comment on whether that would be helpful.
That sounds a brilliant idea, because it's a social place, isn't it? Going to places that are social, where people normally meet socially, is so important in their own space, isn't it? It's meeting people. So I think that's a brilliant idea, and anything more like that would, you know, go down really well. So I'll take that back to the forum because it's a really good idea.
Okay, thank you, thank you. I was also concerned about the 70% increase in child references from CAMS, because we know that before the pandemic, CAMS had a huge waiting list. And I think in the past, they've had to bring in psychology students during the summer holidays in order to try and clear some of the backlog. And I wondered if you could, talk us through how we're going to deal with this enormous increase in the numbers of these children. I mean, we all know what the problems are, but that doesn't mean that they're easy to identify, but not easy to solve. So,
yes, you're right, and of course, Cube is just one agency, and it's a sort of small project, but it's just a reflection, I think, of the needs coming out and the references coming up from CAMS. I know we've got a network with the emotional health and wellbeing voluntary sector meet with the CAMS, not CAMS, the wider team and emotional health and wellbeing to sort of try and look at these issues and develop matters further. I know there's lots of developments coming out of CAMS, and at the moment they've got them out there, lots of these different teams, but the information is not hard information. It's they need to sort of share that information. We all need to be working together around that and looking at. I think it's about linking out and looking at the resources and how those can connect, because a lot of things might get signposted out, but it's all keeping those connections, isn't it? And I think, for example, it's not young people, but in terms of hoarding, people were saying that lots of referrals say from, this is Cardiff, not the Vale, referrals coming out from the council in terms of hoarding to an agency that provides a hoarding support service, but then you don't hear anything. And there's connections around all the other issues that people have, that once you have a connection with somebody and you're working, supporting them, you find out that there's no connections around that to go back and, nobody's keeping hold of that. Who's holding on to that? Who's holding the ring? I think that's an issue. I'm a bit long in the tooth. I remember years ago that wouldn't have been such an issue. Maybe there would have been ways of having joint meetings around that or connecting in. So I suppose that's a sign of pressure, isn't it, on resources and services? But it's making space for those connections is so important. It's not an answer, but it's just.
Okay, thank you. And the last thing I was going to ask you is, what are you hoping the outcomes are going to be from the social care review? I mean, it's been a long time coming, and they've taken lots of evidence, but what do you think would be the best outcomes from it?
Well, I think resourcing not just resourcing, recognising. I know that they do recognise the value of prevention and co-production, but actually sitting down and understanding what that means in practice, and building on their objectives, so that there's some real connections. And I know they've got these communities of practice going, and things that can help in building connections and links, but bringing it down more to the local level as well, so that it works at that local level. Recognising resources that are required for carers and what's required to enable people to live in the community, and unpaid carers and the stresses on that. I know this is all has been in the Act, but it's sort of like making that meaningful and connecting in a yes. Not forgetting the third sector, because I'm bringing those into any plans, because things won't work unless there's community connections and things are anchored on the ground. So that's not very clear. Sorry, we should go back and develop some clear discussion. Come back to you.
Perhaps when it's completed, we could have a presentation on that, because that would be interesting. It impacts on so many areas of what the council does. People that fall between the gaps, kind of thing. Okay, we've got a question from Councillor Wilson, please.
Thank you very much, Chair, and thank you very much for your presentation, Linda. Just a few points, really. I mean, obviously, I work in further education. I work in Cardiff College, and obviously, I teach mostly young people between the ages of 16 to 20, primarily. And what I do see is that, especially since COVID, we have issues of number of people perhaps not engaging as much, as not being as sociable as they would have been. And I think there is a tendency amongst some of those younger people to relate better to adults than their respective peers. And what I'm interested in seeing is what we can do as a council to improve that situation, because obviously one area where we would like to do, if we had the funds, of course, is to spend more money on youth and the youth service. And I know that Conway has done an awful lot of work with the young people down in Wick and the Western Vale, and I know that other people have done also excellent areas of that. But really, I see a lot of young people perhaps on street corners, as there've always been young people on street corners, don't get me wrong, but I just wonder perhaps what we can do to tap into them, as well as meeting those people perhaps who do not socialise so much and spend a lot of their time on the computer. Okay, there are ways to spend the computer socially, playing games with mates and whatever, and that's personally reasonable and fine. But there are other people perhaps who spend perhaps too much on the computer to watch things or to look at things where really they're not socialising with people. And there is a concern I have over that. And I'm just wondering perhaps what you think we could do in the Vale to try to get rid of that. Because not everyone is naturally extroverted. I accept that. Not everyone wants to go to a youth centre. I accept that as well. And I just wondered perhaps, what else we could do to support that. So thank you.
Yeah, thank you. I mean, thank you, because there's a couple of questions there, isn't there? And I think before the pandemic, and I know there were some groups that used to, for people who were maybe more socially isolated, like to prefer to be online all the time. Like before the lockdown, that happened, and the lockdown sort of suited them really, didn't it? Because they could move back onto online, and all the developments that went on with bringing people together and supporting them to meet, sort of went backwards. So I suppose it's enabling those connections to be made again, and that was, I suppose that is through community centres and youth centres and things, isn't it? I mean, that could be a route back again to develop those groups. I mean, it needs to be linked with college and other agencies who might be able to support people to join that, because people wouldn't naturally want to come along. So it's like building in things, isn't it, that would make people feel that'd be worth coming along and trying that out. But I suppose that would be one way, and building those connections with the centres that are already there that operate in that way, and build on that with the schools and with the college. I don't know if that might. I knew that no place where that did work. So if it worked before the lockdown, perhaps that would work again. And I suppose it's building those connections with them, or maybe coming to the college. If there's people in the college that you see, or it's making a connection, isn't it? And then taking it from there. And similarly with people on the street corners. I know we used to have proper projects just finished called Join the Dots, which links with young groups working with young people to have a voice. And we to link also with people on street corners. I know things have moved on to one-to-one level a bit more now, but just going and talking with people can sometimes make a difference, can't it? And then connect people in. It's those connections, isn't it? Connectors and ways to connect in. And I know at the moment we're doing some wellbeing groups. Well, it's more like, it's not necessarily just groups, but connecting with people who maybe just people already in community centres, and different projects, different places like Oasis, and to try and get them to sort of look at health and well-being and around music and ways, sort of finding out what the connections are, isn't it? And then bringing in some things like breathing exercise and things that you think, oh, that'd be quite basic. People might not want young people, but actually they have liked it. They found that really helpful for their well-being. So it's just trying different things like that, isn't it? I would maybe think that would trying and seeing different things, lots of different ways, creative well-being thing, lots of different ways. I don't know. But it's just putting some time and effort into that, isn't it? And keep going.
Thank you very much for
Does
that.
that make...
Yeah, it makes perfect sense. Thank you.
Okay, thank you very much. Right, has anybody got any more questions, please? No? Okay, well, thank you very much for the report. I mean, there was lots of information there, but I feel personally it's raised more questions than it's answered in lots of ways, because there's so much there. I mean, I'd be quite interested to look at in future how you're adopting different methods of outreach, because I think that it's really difficult for people to go back to the way they were before all this happened. I
Yes.
can't believe it's 3 years. I'd be interested to follow up on the child references from CAMS and see how that's being coped with. I mean, I think it probably must go back 6 or 7 years when they brought in psychology students who had finished for the long vac and used them to work with young people. And it, you know, it cleared the backlog. There's no point in a child being referred and then waiting a year for an appointment. It's terrible.
Yes.
Things could happen in the meantime. And I'd be quite
Yes.
interested in a follow-up on the social care review, because I think that's really important.
Yes.
So I'm looking forward to hearing from you in future meetings.
Oh, brilliant. That's
Right,
good.
thank you very much, Linda.
Your interest.
Right. Okay. Is there any? So thank you for that, Linda. Don't feel you have to stay till the end of the meeting, which isn't going to be much longer, I don't think. Is there anything else that we need to address today, please, Karen?
No, Chair, other than to say that obviously the next meeting is 26th of June. And like you said, there's some food for thought in what you've discussed tonight and some extra suggestions that you've made that you'd like to come back to the committee. So we'll look at them, and I'll work with the voluntary sector and see what we can bring to the next meeting as well.
Thank you. And could we have the presentation sent out to members of the committee? Because I think there was an awful lot of information there and people would benefit from it being able to study that in their own time.
Would you be
Thank
happy
you.
if I sent that to all members of the council as well? Because there are
Yes.
some members on here tonight who have
Yes,
come
yes,
also present. And I
yes,
think if I send it to
absolutely.
all councillors, lovely. Is committee happy with that?
Yes, thank you.
Yeah.
Right, Eddie, did you want to come in?
Only thank you've covered that suggestion that other members of the see it. I'd appreciate that. Thank you.
It's a bit of a
Okay.
scrappy presentation, as long as you're happy with that. So,
Well, we can always come back to you with questions, can't we? So at least we've got it written
Thank you.
down all in one place.
thank you.
Okay, has anybody else got any question? No? Okay, thank you very much for everybody for coming, and 26th of June then, please. Thank you again, Linda.
Thank you.
Thank you.